Well, hello, everybody. Welcome again to Conversations with a Doc. This is the last one for 2023, and we thought it was very appropriate, given the time of the year and and what's going on in the world, that the very last session of this year should be about hope. And Dr. Ron Cohen is going to be speaking about hope and off periods. And here to introduce him is Craig Winskowitz. Craig,
Thank you,
up to you.
Judy. I'm Craig Winskowitz, Executive Market Development Manager at Acorda Therapeutics. I'd like to introduce Dr. Ron Cohen, who is a board-certified internist with a medical degree from Columbia Medical School, and he did his residency at the University of Virginia. After practicing medicine, he ultimately founded Acorda Therapeutics out of his second bedroom with the goal of restoring function and improving lives with people with neurological disorders. To date, Acorda has developed and brought to people with MS a drug called Impera, which improves walking function, and Inbrija to treat off periods from people with Parkinson's disease. And I'd just like to say on a personal note, Ron is, I've been with the company for almost 15 years, and there's a reason that I'm still here 15 years later. What you'll notice with Ron is that he's very patient-centric. Our company, everything, it's patients first. And so it really is a great culture that he has instilled at Acorda. So and I'd like to thank Judy as well. I know a lot of work goes on behind the scenes, and I appreciate her flexibility with us during this process. So without further ado, I'd love to introduce Dr. Ron Cohen.
Thanks very much, Craig, and thank you, Judy and Michael. It's a pleasure to be with you all tonight. I'm going to share my screen and my slides, and hopefully you can all see that. Whoop, there we go. So tonight, I'm going to talk about a message of hope, which is the managing the return of Parkinson's symptoms, also known as off periods, with a new class, or relatively new class of therapies called on-demand therapies. I want to make sure everyone understands that my presentation is not a substitute for the primary role of your healthcare provider in your treatment. I will not be able to provide medical advice, and you should be consulting your healthcare provider before adjusting any treatment plan that you have. So as Craig mentioned, I got my medical degree at Columbia, did my residency at University of Virginia. I was going to be a neurologist. My father was a neurologist at Columbia. He practiced till he was 87 years old and was an inspiration for me. He was a wonderful physician. But I've always focused on neurology, even as an internist. I actually practiced medicine in New York, my hometown, for 5 years. And then really by serendipity, I was recruited by two friends from my medical school class who married each other to join a startup biotechnology company that was not in neurology. It was working on tissue engineering. They were growing bone marrow in a dish. They were growing skin and looking to use that for transplantation. So I joined that company. I worked there for 6 years and learned about how drugs are developed. And I became very enthusiastic about it because I realized that if I could join a group that was developing a new drug that you could put in the hands of physicians to help their patients, that I could have an influence that I couldn't have as an individual practitioner. So with the experience I had at my first company, I decided I was going to go back to my roots in neurology and started Acorda initially to focus on restoring function to people with spinal cord injury. And you'll notice the word cord is in the middle of it. I made up the name. I also meant it to convey the sense of accord or collaboration, because I realized that in order to make new medicines that hadn't been available before required tremendous collaboration among physicians and scientists and business people and financiers, and also patients and their care partners. So that was the origin of the company. I founded it out of my second bedroom, as you heard, in 1995. ran it essentially that way for 5 years until we got ahead of steam and got going. The mission of the company has always been what you see here, to develop therapies that restore function and improve the lives of people with neurological disorders. This picture is one of my favorites ever taken related to the company. You see the woman with the Acorda shirt. Her name is Yvette. She was working at Acorda, and we were at an MS walk, multiple sclerosis walk, and we had introduced a drug to help people walk who have MS. And we were at this MS walk, and a woman with MS came over to our booth, and she wanted to find someone to say thank you for what the drug had done for her. And in the course of doing that, she spontaneously hugged Yvette, and someone got a picture of it. And to me, that represents the emotional core of what we do at Acorda. So today we're going to talk about the following three related subjects. First, Parkinson's and the return of Parkinson's symptoms, how that symptom return can affect your life if you have Parkinson's disease, and also the role of on-demand therapies to treat these symptom returns. So first, Parkinson's, and many or maybe all of you already know this. Parkinson's is caused by a deterioration of cells in the brain, most of which make a chemical called dopamine. And dopamine is the key neurotransmitter, the nerve transmitter that allows us to move and allows us to have a lot of different functions, but certainly movement-related functions. As those nerves deteriorate, and we don't know exactly why they do that, we don't know exactly why, there are theories, but why certain people are susceptible to this. As that happens, dopamine is reduced in the brain, and people lose more and more of their ability to move and have other functions as well. The last line on this slide is a critical one. There's a saying in the Parkinson's community that's very true. If you've seen one person with Parkinson's, you've seen one person with Parkinson's. It affects different people differently, and no two people are exactly alike. So the most common medication for Parkinson's is oral carbidopa-levodopa. Levodopa is turned into dopamine in the brain. So it replaces the dopamine that your brain is not making enough of. Now, over time, people notice that even though they're taking their medicines regularly the way they're supposed to, their symptoms can fluctuate. They can actually come back before their next dose of medication is due. And we'll talk about why that is, but that's why over time, people notice that their doctors will adjust their medication. They'll increase the number of doses per day. They'll increase the actual amount of the dose that you're taking. They will add other medications in addition to the levodopa to supplement what the levodopa does. Now, in addition to medication, this is very important. It's not just about medication. It's about lifestyle. We know that exercise, regular exercise routines, can also improve symptoms, social well-being, emotional quality of life for people with Parkinson's. We know that continuing to be socially active and having positive social relationships also improves health outcomes. Now, those are very important in addition to medication. They do not replace medication, but the way you have to treat Parkinson's is all of these holistically. And that brings us to on and off periods. So what is an off period? Well, people can call it wearing off periods because your medication is wearing off, or turning off period because it feels like you are turning off and not able to be active and motor function and do the things you want to do. But either way, you can call them off periods. An on period is essentially when you're functioning pretty much normally and you're taking your medicines, they're working the way they're supposed to, you're well controlled. Off period is when you're thinking, it must be time for my next dose, because you realize on some level that some symptoms are coming back, and it's not. Maybe it's an hour to go. It might be an hour and a half or 2 hours to go. That is typically a sign that your symptoms are returning even though you're taking your medication. Why is that? Well, before we get to why, this is a schematic that shows the fluctuations of your capabilities during the day. In the green, this is the high point where you feel normal, you feel controlled, you can do what you want to do, you're active. The yellow is things are just not quite there. The red is where you're seriously you have serious symptoms and you're quite impaired, very difficult to function. Now, hold on just a second. There we go. So Parkinson's and what you eat can cause this problem. So you take your oral carbidopa levodopa by mouth. It goes from the mouth down into your stomach and then into your small intestine. That's where it gets absorbed in your duodenum, the small intestine. Parkinson's itself can slow the movement of your gut. It can slow the stomach. It can slow food and pills from going through and getting absorbed. There are many different mechanisms by which it does that, and each person has a different set of mechanisms. Also, your meals can slow down the absorption of the levodopa. So if you take it after especially a high protein meal, you may find that it's taking much longer to feel relief, to feel your symptoms going away. Now, forgive me for springing that not that fairly unsightly picture at you on the left, but it's very important. This is a study that was published in a major medical journal, a major neurology journal, in which the researchers asked volunteers with Parkinson's to take a carbidopa pill. So there was no levodopa, it was just carbidopa, because they didn't want to change their regimen. But they wanted to illustrate what happens to a pill when you swallow it with Parkinson's. The picture on the left that you see that pill? That was taken an hour and a half earlier. It hasn't moved. It hasn't gone into the small intestine. It hasn't been absorbed. There you have a very clear illustration of why, depending on who you are or where you are in your course of Parkinson's, or even on what day of the week it is, you may take your pill and realize, oh my gosh, it's not working, or it's not working fast enough. It's not working the way it's supposed to. Now, if you look on the right, this is a study that my company did, in which we gave people with Parkinson's, 15 different people who volunteered, we gave them a regular oral Sinemet, a carbidopa levodopa, 25 100 milligram dose. And then we measured the level of levodopa in their blood every half hour, 30 minutes, 60. So you see on the bottom there on the axis, 30, 60, 90, all the way to 3 hours, 180 minutes. And on the left, you see the concentration in your blood. And the higher you go, the more levodopa is getting into your bloodstream and then therefore into your brain. Now, what do you see here? It looks like someone threw a plate of spaghetti against the wall, right? Some people, like this person in blue, and I don't know if can you see my cursor, Judy, here? So you see this person, this in blue, that person's fortunate. They got to a peak level in their bloodstream within 20 minutes or so, okay? Here's someone who got there within 30 minutes, but you see this person has a much higher level than this person, and this person has a much higher level than this person. So even though they get there in 30 minutes, they don't have the same level in the blood, and that might affect how well it's working, because a very high level might give them dyskinesias or involuntary movements. A too low level might not be enough to completely make them feel normal. But the real interest here is look at all these other people. Here it takes an hour. Here it takes an hour. Here it takes 2 hours for all these people. And some people like, oops, sorry. Some people like this person here never gets a therapeutic level. It never gets absorbed even 3 hours out, which puts you back in this sort of situation. This is why people get these off periods. Now, on the left, you see the same graph I just showed you, but what I want to compare it to show you the additional impact of when you have a meal. So on the right, this was a different study with 17 different people, not the same ones that were in the study on the left. And the only difference here, they also got the oral carbidopa-levodopa. The difference is that on the left, they had not eaten before they took their pill. On the right, they had a high-fat, high-protein meal before they took the carbidopa-levodopa. And look, you see the same spaghetti plot with a very important difference. Nobody gets a peak level within 30 minutes. The earliest anyone gets one is an hour. So it shifts everything to a longer period of time, because the food, in addition to the Parkinson's that's already affecting the gut, the food is affecting it even more and preventing or slowing down the release of the carbidopa. So when you have Parkinson's, you're really up against it, because sometimes you're taking your carbidopa-levodopa, your doctor tells you to take it 4 times a day or 5 or 6 times a day in some cases. And then you're stuck because you think, well, how am I going to time my meal so I'm not taking it within an hour of my meal, and that's going to affect it. So you wind up with that issue. So how does symptom return affect people's lives? Well, it can happen in several different ways. It can be gradual. You can just sort of slowly, your hand starts to tremble a little bit. Maybe you have a non-motor symptom. You start to feel anxious. You start to feel fatigue. And then you realize it's more and more difficult for you to move. You can't get out of a chair. This can happen all of a sudden. It can happen gradually. It can happen in the morning when you get up and you haven't had a dose since last night. There are several different ways. They can be predictable, where you know, hey, every day at 2 or 3 in the afternoon, this happens. They can be unpredictable. It happens just out of the blue. You don't know when they'll begin, how severe they're going to be, how long they will last. And as I said, there are many different types of symptoms, and each person will have different arrays of symptoms. And by the way, you might have different symptoms as you yourself. One person might have different symptoms on Monday afternoon than they had on Sunday morning. It just depends. So you see the motor symptoms on the left. I won't read them all to you, but you can read them. And then non-motor symptoms, very important to realize, because these are more difficult for people to recognize, because you're drowsy, your thinking gets fuzzy, you feel restless or anxious, maybe you have some achiness, mood changes, you feel a little bit down. And the natural thing is to conclude, I'm having a bad day, it's raining, I feel blue, I'm anxious. It's very likely that this is actually a sign of your symptoms coming back, or an off period. And take a look at the question below. You can feel free to answer it in the chat if you would like, just so everyone can tell. But the question is, how many times a day do you or your loved one, your care partner, notice or experience a return of any of these types of symptoms? Now, this has an impact on many people, a real impact on their lives over and above just the symptoms. So do you find yourself over time avoiding going out or not making plans because you're worried that your symptoms might return if you go out and do things? Do you avoid sometimes going to work if you're working, going out to eat, seeing your friends and family, social occasions, participating in your hobbies, favorite activities, going to church or synagogue, exercising, which, as we've said, is very important? Are there times when you just go, you know what, fellas, or you guys go out golfing today. I'm tired. I don't want to go. Think about that. Different people are affected in different ways. I won't read these quotes to you, but you might want to take a moment to read just examples of how people find that off periods and symptom return affects them. And you might start thinking, how do you first recognize symptom return if you have symptom return? How does your care partner, if you're a care partner, how do you recognize that your loved one is starting to have symptom return in between regular doses? And by the way, this can happen even if you've got a Duopa pump, even if you've got a DBS, direct brain stimulation. These off periods still can happen even though you've got this sort of constant stimulation going on or medication going on. So this brings us to, what's the good news? What can you do about this? Well, your doctor may consider, as we said, adjusting your regular medications when you're starting to break through, because for most people, Parkinson's is progressive. Over time, it tends to get more and more pronounced. And so your doctor may recognize that and then give you more levodopa carbidopa. They may give you a long-acting carbidopa levodopa. They may change the formulation. They may add other medications that work differently from carbidopa levodopa, but which supplement the effect. They add to the effect of the carbidopa levodopa. And the other thing they can do is they can now give you an on-demand therapy in addition, and they go together like these puzzle pieces do. It's not either or. They work in concert to give you a set of tools that you can use, not just one tool, but a set of tools depending on your need. The two non-oral medications that are available now, one of them is an inhaled levodopa, and the other one is an injectable subcutaneous apomorphine injection. So what do we mean by on demand? We mean that you use it only if and when you need it. When your regular medication is not working as expected, you're having breakthrough symptoms in between or somewhere in the middle of your day or night, you then take it to get quick, immediate relief and to put you back in a situation where you're not having the symptoms. So it doesn't replace your regular medication. You use it when your symptoms return. And the way you can think about it is, there are people who have migraines, and now they can get these wonderful medicines. They're injectable, mostly. Some of them are oral, that reduce their migraines by 80%, 85%. But their doctors typically will give them short-acting pills to have at home for those 10%, 15% that they're still having, because you still want relief, right? An EpiPen. People take allergy medicine, but then they get stung by a bee or they eat a peanut or they're near peanut butter and they need an EpiPen. So it's an as needed. When do you take an on-demand therapy? You see, again, this graph where you have the green area, you're feeling normal. You can take it at any point where you're starting to feel that your symptoms are coming back. You can take it in this greenish yellow area, the yellow area. You can certainly take it when it's full blown over here. It's better to take it when it's earlier, because that way you can abort the off period, and you don't have to wind up all the way here, but you can take it anywhere in that situation. And someone is asking, how long does the on-demand therapy work? These therapies work for a while. Now, it depends on the therapy and what the clinical trials were, but studies have shown that typically they will work long enough to bridge you an hour, 2 hours, thereabouts, depending. And this is something you can ask your doctor for the specific on-demand therapy, what it does. So how should you think about this? It's very important that your healthcare provider, your physician, the nurse practitioner, whoever you're seeing, understands that you are having a return of Parkinson's symptoms and what the impact is on your life. And one of the things I recommend to people is keep notes at home, keep a little journal. Maybe your care partner can help you do that, you can do it, but just keep notes to jog your memory so that when you do see your doctor, you remember to tell them these things. And this brings me to a really important point. As someone who has practiced medicine, I will tell you this is a very real point. Actually, there are a couple here. One is patients come to the doctor, and very often we don't want to disappoint the doctor. Now, this sounds strange, but it's very real, and I hope some of you are smiling, recognizing that you might be doing this. We don't want to disappoint the doctor. So the doctor says, how you been doing in the last 6 months, 4 months since I last saw you? And typically the answer will be, oh, good, fine, fine. It's not fine, but you say it's fine because you want the doctor to feel good about treating you. It sounds odd, but it's counterproductive, and you need to resist it because you and your care partner are your own best advocate. And without the information that I, as a physician, get from you, I don't know how to give you the best treatment possible. So everyone's got to level with each other in this equation. There's another issue that goes on, and it's on the doctor's side. And I'll tell you, it's also very, very real. Because the doctor can be disappointed. I'll just level with you. The doctor can be disappointed. They shouldn't be. But if they hear, oh my gosh, the symptoms are coming back, there's a thought in many times where they say, that's my failure. That's my failure. I didn't give them enough medicine. I didn't give them the right medicine. And so what their default will be is to add more medication. And you may well need that, but they're not thinking, I should give my patient the ability to treat their own off period at home with an on-demand therapy. Because if they do that, they're thinking, well, that means I'm not a good doctor. I'm not treating them with the right regimen. I know it sounds strange. I'm telling you, it's very real. I've talked to over 300 doctors in the field, and this is what goes on. I've talked to many, many patients. So it's very important that you advocate. If you say to the doctor, listen, my care partner, I think they really could benefit from one of these on-demand therapies. And the doctor says, they don't need that. Don't accept that. Ask them why they don't need that. Ask the question, why not? Don't just say, oh, okay, and leave. Say, well, explain to me, please, why is this a bad thing? What doctors need to be educated about, as well as everyone else, not all, because many of them know this, is that it's not their fault. It's the disease's fault. It's the disease that is preventing the medicine from being absorbed properly over time. And on-demand therapies help to address that issue. So when you talk with your doctor, tell them about your return of symptoms. Tell them what the symptoms are, when they occur, how often are they occurring. That's when your journal will help you. And are there situations where they occur more frequently? And some people find, if I'm cooking a meal and getting ready, or I'm feeling a little bit stressed, that's when they come back. So you need to tell them. You need to tell them, how does that make you feel? What is it doing to you in your life? Have you stopped doing anything? Have you been avoiding anything like social activities, hobbies, work, exercise, other activities? Very important to let your doctor know. Do you no longer go to rock steady boxing or golfing because you're worried it's going to happen and you'll be embarrassed in front of everyone? That's very important for the doctor to know. So if you and your doctor decide on an on-demand therapy being right for you, in addition to doing that, then you should be asking your doctor what resources are available to you. Companies like ours who have such therapies or who are providing such therapies, all of us provide assistance for patient access, for co-pays, for training on how to use these medications properly. There's lots and lots of additional information and support, websites and so forth. So your doctor shouldn't just give you a sample, if they do give samples, and say, here, try this. That's not good, because these are medications that require some training. They're new, they're not pills. And the reason they're not pills is you don't want to have the same issue where it's not being absorbed. You want to bypass it either by breathing it in or injecting it. And that way you're not stuck with this problem of the gut interfering and you get a very rapid response. But in order to use these properly, the doctor needs to help train you and tell you what resources are available so that you learn how to use these excellent medicines properly. And that brings me to the end of my prepared remarks. I think it's very important that all of you, whether you're a and I had another point to make, which is if you live with a care partner, with a loved one, it is critically important that you both go to the doctor when you have your visits. Critically important, because this is true in all of medicine, not just Parkinson's, and I will tell you this from experience. The care partner is a more objective reporter, because if we have a condition, we tend to rationalize it. We have all kinds of tricks we play to keep ourselves up and going and so on. The care partner sees what's going on, and I can't tell you how many times I was practicing medicine and I would talk to my patient and they'd say, oh, everything's great, doc. And the care partner would be there and they'd give him a little slap across the shoulder and go, what are you talking about? And then they would tell me what's actually going on. So do that. Make sure you're both there so the doctor gets a more complete picture of what's going on. If you do that, what I can tell you is I've been so heartened to see how many people with Parkinson's and their loved ones have been benefiting from these on-demand therapies, because it gives them a tool where they have control. They are able to address the issue at the moment it occurs. They don't have to wait 4 months to go back to the doctor and have all their medications adjusted and so on. It's really empowering. So I strongly encourage you, again, advocate for yourselves. Don't take no for an answer unless you get an explanation that makes sense to you. And with that, I want to thank you all for having me come and speak to you about these important issues. And I would love to take any questions if you have them.
I do. People submitted them earlier. And the first one is, are there therapies applicable to people with Parkinson's who aren't yet taking medication, but who do experience times when symptoms seem to vary in intensity?
Okay, so if someone has Parkinson's and they're not yet taking medication, I guess my first question would be, why are they not taking medication? I think the usual answer would be, well, I don't feel that my symptoms are bothersome enough for me to be taking a medication. Honestly, there are other reasons. And this is, again, what we all do when we have a condition or an illness. None of us wants to be sick. Nobody wants to be sick. Nobody wants to have a condition. And especially early on, we talk ourselves into, yeah, I'm fine. I'm okay. I don't need anything. And I've seen people take that to extremes that maybe are not as beneficial to them as if they were taking medication. Usually, if the person needs to come to the realization that, hey, I will, I need to take something. I want to be better than I am. I will tell you that even as a physician, I work out all the time. I eat healthy. I think I'm a doctor. I try to practice what I preach. And a couple of years ago, I went to a doctor for the first time in 15 years and had, because doctors are terrible patients. And my doctor discovered that I had high blood pressure. And I was stunned and I refused to believe it. So, and he wanted to put me on medication. I said, no, I'll just go home. It's an accident. So I went home and for a month, I took my blood pressure at home and I worked out and I cut down my salt and I did all that. And I still had high blood pressure. So I started taking medication. And I have to tell you, the, the pleasure that I get when I do the blood pressure cuff and I'm 120/80 far exceeds my resistance to admitting that I had high blood pressure, because I know it means I'm protecting myself from heart attacks and strokes and so on. Same with any disease. So the person who has early symptoms, you may be fine with it, and that's okay. It really is a matter of deciding, you know what, I'd rather not do this all the time. I'd rather not be stiff in the morning or whenever. And that's when you talk to your doctor and they'll put you on a medication. The most common medication, 70+% of the time to start with, is going to be carbidopa levodopa. That's the gold standard of Parkinson's disease. But sometimes they may put you on a different medication, a mild medication that has a different mechanism, just because it's early on, and they'll see if that helps and how long it helps. So it's really between you and your doctor.
Next question. What are the dangers of overuse of carbidopa levodopa?
So there was a period of time, years of time, levodopa carbidopa has been around, or levodopa has been around since at least the early 1960s, maybe the late 1950s. So it was really the first real drug for Parkinson's. And remarkably, it's still the gold standard because it's exactly replacing what you're missing, which is dopamine in the brain. There was a period of time where some research was published and people were debating, well, if you stay on dopamine or levodopa too long, does it actually have a deleterious effect, a harmful effect on the cells in the brain and so on? That has long since been debunked. So that is not the case. It is not the case that by taking dopamine over a long period of time, that is toxic. What is an issue is if you don't get steady levels of dopamine over time and you're fluctuating like this, that can have an effect on dyskinesias and off periods and so on. But there's no reason to fear levodopa itself. You should actually be embracing it because it really is a gold standard drug that is replacing what you're missing.
What are the physical?
I'm sorry, Judy. I'm sorry, Judy. There is one more point.
Okay.
Now, if you take too much levodopa, that's an issue. So if you take too much levodopa, you can, and in fact, if you take too much of other drugs too, you can wind up with the opposite problem from off periods, which are called dyskinesias, which is involuntary movements. So, where you start doing this and you don't want to do that, but you're moving without wanting to move. So it's the opposite of an off period where you're not moving enough, even though you want to move. And it's exactly the mirror image. It's that you're getting too much stimulation of those nerves in the brain, and they're firing without you wanting them to, so you're moving. So your doctor always has to regulate the sweet spot between giving you too little medication and too much medication. And by the way, that's where on-demand therapies can help, because they can keep you here, with your medication. And if you dip, then you just quickly, you take the on-demand and you're back to there, instead of overshooting and going up here and getting dyskinesias. Yes.
Okay. What are the physical and or chemical changes within the body dynamics that cause symptoms of Parkinson's, such as tremors, to become more pronounced and disturbing in stressful or anxiety-filled times and situations?
Yeah, so it's a very complicated. The answer is very complicated. The question is a good question. It's a very complicated answer. Um, Parkinson's affects more than one area of the brain. There's what's called the nigrostriatal pathway, and that's a very technical biological term for one of the main areas that's affected. But it actually has an effect on multiple areas in the brain, and there are several neurotransmitters, the chemicals that nerves use to talk to each other, like dopamine, that can get involved in the process. And depending on what your particular mixture is of places in the brain that are being affected more than others, you can get these different types of symptoms, and they can be triggered by different stimuli. So as you said, if you're feeling stressed or you get anxious, that can trigger even more, because it sets off different signals all over the brain or in different parts of the brain. And as I mentioned, if you're feeling anxious, that itself can be a symptom of Parkinson's disease. And so then you get into this loop where the Parkinson's is giving you anxiety, and the firing in the brain of the anxiety is leading to additional issues in the way your brain is functioning.
I'm not sure you can answer this next one, but I'm going to ask it anyway because it was submitted. How is the best way to manage cramps in legs, feet, hands, etc.?
You are correct. That is because it really depends on why you're having the cramps. And there can be a number of reasons, including obviously the Parkinson's itself. That is a question absolutely to ask your doctor. That would be one of the symptoms that you need to report when you see your doctor, or call your doctor, or email your doctor and ask them, hey, I'm having this. Can we talk about what I can do about it?
I think the next one's going to fit in that same category. What are the best medications for incontinence?
Same category.
Okay, this one is not, though. This one might be a good one. I seem to find myself in a dilemma between taking my carbidopa-levodopa before I eat and having brain fog and sleepiness, versus delaying my dosage and having off times, such as mild tremors in my left leg. Any thoughts?
Absolutely. This goes right to what we just went through in this presentation, right? These are exactly the kind of issues that folks with Parkinson's deal with around meals, and should I take it now or should I take it then? And this sounds like a very probable situation where an on-demand therapy might be very useful to you. Now, again, that's something you need to talk to your doctor about, but this is exactly what the on-demand therapies were meant to address, where your medications are not lasting as long as you need them to, and when you eat a meal, they last even less. And what do you do about that? Well, an on-demand therapy might be quite helpful in that situation, something to talk to your doctor about.
Are there different kinds of off periods?
Yes, there are. There are several different kinds of off periods, and I had touched on those a little bit. There are predictable offs, as we discussed, where for whatever reason, that at some particular time of day, 10 in the morning, 4 in the afternoon, thereabouts, no matter what, you wind up going into an off period. It's predictable. And by the way, those tend to be more susceptible to changing your daily medication routine or doses because they're predictable. So the doctor may look and go, well, right around, your dose before that time of day, let's increase the dose to X, or I'll give you a longer acting form of carbidopa levodopa, that sort of thing. A lot of offs are what we call unpredictable. It's exactly what it sounds like. You don't know why, you don't know when, but all of a sudden, you're on the 8th hole at the golf course, or you're singing in the choir at church, or you're cooking a meal, and all of a sudden, boom, it starts happening. You don't know why, and those are more difficult to treat. And by the way, on-demand therapies are ideal for that sort of situation. There are early morning offs. A lot of people find that, they didn't take a dose, and by definition, until since the night before they went to sleep. So when they get up, you don't have as much of your medication on board, or you might not have much at all. And you find, oh my gosh, it's hard to even get out of bed and change and go to the bathroom. A lot of folks, so this may be familiar to you, actually keep their morning dose of medication on their nightstand with a glass of water. So when they wake up, they take it and then they have to wait. Some people will take an on-demand therapy first thing in the morning together with their first oral dose to give them a leg up, as it were, and speed up their ability to get up and start their day, get dressed, and do all those things. So some people get off periods in the middle of the night and wake up and realize they're in an off period. So there are various types of off periods. And again, that's exactly what you need to talk to your doctor about. When do I get them? Are there specific situations I associate with them? Does food affect it? Is it in the morning? And so on.
And the last question is, does everyone on levodopa get dyskinesia?
The answer is no. Really, it depends again on the individual. So it typically is related to the dose that you're getting. And if you get too high a dose, that can throw you into dyskinesia. If you, let's say, are taking, so let's say you have a problem sometimes where your gut is not absorbing it, but other times it is absorbing your pills quickly. So a dose that works when your gut is not absorbing quickly because it's a higher dose might be too high if you happen to be at a moment in time where your gut is absorbing quickly, and now you're getting the full high dose and you get into dyskinesias. There's also a phenomenon over time. So as the years go by and the disease tends to progress, and you've been taking various medication regimens over time, there is a phenomenon where people start getting dyskinesias even at the same doses and regimen that 6 months ago was not causing dyskinesias. And that, again, that's something to talk to your doctor about in terms of adjusting your regimen, changing drugs, and also, by the way, potentially adding an on-demand therapy.
Okay, I don't have any other questions. Nobody chatted anything. So I want to thank you very much for coming this evening. I thought it was a great talk. And I got to tell you, I love the picture of the undigested pill in the stomach. I think that's great.
Once you see it, you never unsee it. It's
That's right. I'll never forget that. Absolutely. So I want to thank you for coming, and I hope everyone has enjoyed the series over the year. And we will be sending out a survey. Please take a few minutes. It's not a long survey. Please just take a few minutes to evaluate what you've heard this evening. It helps us figure out what to bring you now in 2024. So happy holidays, everybody. Have a good, safe, wonderful, healthy, happy holiday. Thank you.
Happy holidays to all, and thank you. It was a pleasure.
Thanks. It was a pleasure having you.